Welcome back to McLaren Port Huron's Today's Health, and we're talking with board-certified cardiovascular thoracic surgeon Vernon Dencklau about coronary artery disease. Okay, we talked a little bit in the first segment about what it is. What happens if it goes untreated?
Not treating coronary disease results in either symptoms or major problems. What happens is when the arteries that we described on the surface of the heart, as they narrow, you then get dysfunction or a lack of good function of the muscle that vessel supplies. How bad the symptoms are can depend on either how bad the blockage is or what's happening at the time. If it's just a narrowing and you've provided too much demand on that part of the heart, and you relax, you stop exercise, you stop what exertion you're doing, then the chest pain that you're experiencing can relax, and that would be just termed an anginal episode. If it's been an abrupt blockage, then it can progress to actually heart damage, a heart attack, where actually that muscle actually dies.
What are the symptoms then, are there symptoms other than chest pain of a heart attack?
Obviously, chest pain is the most prominent one, and it's most commonly described as an elephant sitting on your chest. But it can be atypical. Some people have this pain radiating up into their neck, up into their jaw, into the left arm especially, or into both arms, or into the back. I can't tell you how many people I've seen and treated for heart attacks that felt that it was indigestion. And the best way to determine those two is that if it has the characteristics that one typically considers a heart attack, it needs to be checked out, especially if it lasts more than a couple of minutes. The other symptoms like heartburn, you could simply try some Tums. If it doesn't go away quickly, then you're thinking maybe it's not heartburn, and then again it should be checked out.
So what should you do if you are having some of these symptoms and you're thinking, gee, maybe I am having a heart attack?
Like many things, you have to exercise a little sense about how bad they are and how urgent they are. If you have significant chest pain and it lasts more than a few minutes, then you need to seek emergency help, and you should be seen in an emergency room. And again, depending on the acuity of the symptoms. If you're having typical chest pain, then it would be call an ambulance. If you have a little bit what seems like indigestion and it goes away, then that would mean a trip to your doctor to have him check it out in more detail.
So why is it so important to call an ambulance if you think you're having a heart attack, if you really have chest pain?
There are several reasons for that. Number one is you need to be treated quickly. In our parlance, we say that time is muscle. The longer the heart muscle is deprived of proper oxygen and nutrition by having a pinched artery, the more damage to that heart muscle. And in fact, if it goes long enough, you can actually have that muscle be dead and beyond repair, that portion of muscle that's supplied. Also, if you are having those kind of significant symptoms, you can actually develop a funny rhythm because the heart is more irritable when it's deprived of oxygen. And those rhythms can make you pass out or make your heart not function well enough. And when the circulation stops, you stop.
Well, obviously there's a lot of anxiety, and you know, I personally live really close to the hospital, so what would be wrong with my husband and I just jumping in the car, getting to the hospital as quick as I possibly can?
There are a couple of things that make that not a good idea. Number one is if you're driving yourself and you get an arrhythmia, VFib or VTAC, or one of these arrhythmias that means your heart isn't functioning, you stop functioning, your brain stops functioning, crash. If that happens and you're being driven by another person, they've got nothing that they can do. And if your heart stops or isn't functioning properly for a period of over 3 or 4 minutes, then you can have lasting damage to your organs, like your brain. And so it's best that you get the fastest help possible with EMS. They can quickly put you on monitors. There are certain treatment regimens that they can use. They can communicate immediately with the emergency room and emergency room physician. So even if you're not in the emergency room, you can get treatment. Also, if their EKG monitors, which are transmitted back to the emergency room, show what we call a STEMI, or ST elevation MI, an EKG picture that looks like a heart attack, they can then mobilize the team to deal with that with stenting or other treatments.
So are there things that would be helpful that I could do while I'm at home waiting?
There are a few things. Number one is sit comfortably and relax. Do your best to calm yourself. That decreases the demand on the heart. The less beats you have and the less blood pressure you have, the more easy it makes on your heart. Chewing an aspirin at that time has been shown to be of some benefit. It makes our platelets or clotting mechanisms within the blood a little less sticky and does have some benefit. If you are a patient who has been known to have heart disease and have nitroglycerin on hand, putting a nitroglycerin under your tongue and another one every 5 to 10 minutes after that for up to 3 may help as well.
Well, we're going to take a break and come back and talk a little bit about treatment.